Good morning to our Saturday Healing Connections meeting for March 21st, 2026. And I am pleased to have Bill Reddy back talk to us again about this long COVID. And I want to introduce Bill Reddy. What I find so fascinating by people that do any kind of energy work is that they don't start off most of them don't start off doing energy work. It's something that they evolve into. And what's interesting about Bill is that he started off, to me, so steeped in science. He was an aerospace engineer. I mean, how do you ever put this together? It's kind of amazing to me. He flight tested helicopters for the Navy, worked with satellites, Air Force Space Test Program, has a master's in mechanical engineering, I mean, systems engineering. It's just kind of a odd combination to eventually what was it in the 90s that you got into acupuncture and got into this energy work. And what I think is nice about it is that when Bill Reddy talks to you, that he is talking to you about these holistic ways of treating yourself for long COVID or for any problem that you may go to him for. He's doing it with a scientific background and a scientific mind. It's all evidence-based information. So anyway, I could go on. His bio is on the Gene Watson website, and it's very impressive. But I think this is who Bill Reddy is that he'll tell us holistic ways to help us that are based in science. So we'll just start with a little centering, just to get us all together. And we'll just take a couple of breaths here and just come to the center of our being. And when we come to the center of our being, we're bringing in that life force. And it brings us to the center of our body, where the lungs and the heart is. And just connect with that heart, with the compassion that we're always attributing to the heart, and the harmony, that right relationship with others. It's so important. And that sense of unconditional love that we have for all others, anything that is living on God's green earth. And then ground ourselves in Mother Earth. Just feel her gravity, her pull, her rhythm, and connect with whatever is in the heavens, in the universe, that gives you meaning, gives you purpose. And bring those energies, those thoughts into your heart center. Just let them expand that heart center as we listen to Bill with this energy work that he has been able to, teach us and help us to learn about. So Bill, I'm going to hand it over to you. And you are one of the most grounded people I've ever met. So
I appreciate the kind words. I want to thank you, Carol, for all the good work that you do and for inviting me here, and all the team that it takes to record and edit and do all the things that I can't do. Although I recently got this little device called an OBSBot that's a 4K camera, and so I'll be starting a podcast before too long. So I will learn how to do this in time. But what kind of got me started with the long COVID thing was that I was in a hospital system in Inova back in 2019, and I was considered a non-essential employee. And so I volunteered at the COVID Coordination Center. And I had a lot of time on my hands. I was answering phones, and there were a lot of nurses that were frightened because they were exposed to something and they didn't really know what to do. And in my spare time, I started studying it and noticing about what the spike protein does. I noticed about the chronic fatigue syndrome and that there's a connection between them. And so I wrote an article a while back on mitochondrial dysfunction and long COVID, And I went on to notice that nattokinase is something that's an enzyme that can inhibit spike protein into the cells. And your folks may have heard of natto, which is a Japanese breakfast food. And so that's what I called the article was how to fight COVID with a Japanese breakfast food. But so I noticed that the patients with long COVID would see their doctors and they just didn't have any answers. And so I've been poring over this literature since 2019, 2020, but I ended up writing this paper here, which was published in late 2025. It took about a year to get published. And so a good deal of what I'm going to be speaking of today is based on this paper. And then since that paper was written, I've snooped more. And so I've got more information than what's currently in this paper. But the QR code is something that people can just flash and bam, they can get access. This is an open access paper. And the reason why I went with a commentary instead of a full-blown academic paper is because it's easier, because I don't have to read as much. The full-blown academic papers, they expect at least 100 references or whatever. And so I just had about 65 papers that I read and tried to squish it into 6 pages. So it was kind of like stuffing a king-size mattress into a carry-on. It's a real challenge for me to try to get all the information that I learned and try to distill it down into something that a typical very busy physician could just access and be able to make some clinical decisions. So if people who are watching this post, I'm sure they have questions like, well, how can I identify a long COVID patient? And are there any blood markers that can identify them? And what tools are available to me? And maybe what clinical guidelines are available for my decision making? So let's start from the beginning. There was a very, very tiny singularity and of infinite mass, and there was this huge explosion about 13.7 billion years ago. Okay, maybe that's too far back, but the reason why I bring up the Big Bang is because really what COVID is a constellation of symptoms. So today what I'm going to cover, and it looks like a lot, and it is a lot, is just how is post-COVID syndrome defined. I'm going to talk about nootropics and functional medicine. I should have put it in alphabetical order, so then acupuncture would be on the top. But as you can see from the list, there's a number of things that I'm going to cover today. And some of them are really, really interesting, and some of which you probably are aware of, like fasting and detoxification, and maybe vagus nerve stimulation. But we'll go through one at a time, and of course, afterwards, I'll open it up to any easy questions that people have. So when I've noticed the literature, what it all has in common is that it presents in symptoms lasting anywhere from 1 to 3 months post-COVID, that you actually don't have to be hospitalized. You can have a very mild case of COVID and you can still have long COVID. There's different names for it. The World Health Organization calls it post-COVID-19 condition. The CDC calls it post-acute sequela of SARS-CoV-2. The National Institute for Clinical Excellence, or NICE in the UK, calls it post-COVID-19 syndrome. Long haulers is the name that you gave it today. So there's just a broad spectrum. And there's more than 200 symptoms associated with it, which can also just kind of cloud the clinical decision making. But as you can see, when I look through, the big ones are fatigue and headaches, brain fog, shortness of breath. POTS is postural orthostatic tachycardia syndrome, non-restorative sleep. Exercise intolerance is a really big one. If your patients mention that they have a loss of taste or smell, if they feel this strange vibration in their bodies. Joint muscle pain, depression when they normally are not depressed. These are things that should raise that flag and tell you that maybe you have something beyond just typical malaise or chronic fatigue. So if you look at the CDC's practical advice, I think I have that here. Yes. So what they say is just find out what's most important for the patient and suggest symptom management associated with fibromyalgia, dysautonomia, mast cell activation syndrome, Lyme disease, but it really doesn't address things that are important, in my opinion, like microclot formation and immune persistence that goes on that's specific to long COVID, in my opinion. The NIH acknowledges long COVID as a chronic system disease, but it really lacks any kind of environmental or iatrogenic or immune-triggered cofactors. It doesn't mention any biomarker validation. And NICE endorses LDN. For those familiar with that, that's low-dose naltrexone. And that's something that is quite effective. And they also recommend antihistamines and some anticoagulants for the microclot collections. And we'll talk a little bit about microclots coming up. And the World Health Organization, when I read their clinical guideline, it was more talking about prevalence and disability impact, and it offered some generic therapeutic guidance. And something that's not on here is that there's an Australian paper that's entitled Spikeopathy, COVID-19 spike protein is pathogenic, both virus and vaccine mRNA. And it was one of the first that defined spikeopathy as being an infection or pharmacokinetic transfection through body tissues distant from the injection site by lipid nanoparticles or viral vector carriers that can infect many organs. And what can these do, regardless of where it comes from, is it can trigger cytokine shifts. It can trigger clotting abnormalities. It causes brain inflammation similar to TBI, and there's some measures of that coming up. It can trigger the mast cell and mast cell mediators, and finally, it can make cancer more likely. So what the literature all has in common, in my opinion, is there are 4 root causes, and they are persistent viral reservoir in different organs. There's autoimmune reactions triggered by the spike protein, which I see in my office all the time, and I see nodding heads here. Tissue damage and dysfunction, and finally, reactivation of latent herpes virus, EBV, and Lyme. And that's why you have something that they have one problem, and then all of a sudden something else rolls on top of it. And post-viral infections are not new, and there is literature from the 1900s stating that. So it's not special to long COVID, but it certainly is something that's there. And I think I may have some stuff on blood markers coming up. This is it's a status scale of functionality for COVID patients. And the person who made it is called CLOK, K-L-O-K. You can see at the bottom of the screen. And so this just basically gets an idea of going from 0, where there's no limitations, all the way to 4, where they can't even work. And so this is something that can be used as some kind of clinical measure. And so one of the big blood markers, I don't know if the image on the far right of the screen is blocking D-dimer in your image, but D-dimer is a big one. So D-dimers is something that's really huge as a measure. The other big ones are IL-6, CRP, which are generally looking at inflammation markers, TNF alpha is another one, and you can see that the change, all of these are elevated in long COVID. Um, Neurofilament light chain, NFL, is something that was news to me. I was unaware of this particular measure, but that's something that really connects with the brain fog and the dizziness and all that associated with it. Um, and the GFAP is another one that's a brain injury marker that shows neurological problems. TGF beta is more related to pulmonary symptoms, but again, something that should be addressed and looked at. Before we get to the mast cell activation, I wanted to talk a little bit about POTS because that's something that it just seems like over and over again I'm seeing my patients that have this and are suffering from it. And so I looked to see if there are any clinical guidelines, and I found one in 2015 was the latest one that was run. It was called this is a mouthful, the Heart Rhythm Society Expert Consensus Statement on the Diagnosis and Treatment of POTS, Inappropriate Sinus Tachycardia, and Vasovagal Syncope. And it went through and it mentioned that POTS is the frequent symptoms occur when standing, so lightheadedness, palpitations, tremor, generalized weakness, blurred vision, exercise intolerance. Usually there's an increase in heart rate of about 30 beats per minute from sitting to standing. So that's what I do for my patients. I know there's a tilt table and some other more advanced tech, but for a simple office like mine, I just put on the blood ox and have them sit for a while and then stand and then see if there's a change of about 20 to 30 points. If they're a child between 12 and 19, then it can bump up to about 40 beats per minute higher. The prevalence of POTS before COVID was about it's usually 75% female between the ages of 15 and 25, and people suffering from chronic fatigue. That was kind of where it used to be. And interestingly enough, I've heard that patients say that when they're going from being out in very, very hot conditions and they go into air conditioning, that it's like being struck by a wrecking ball, that the temperature changes can really mess with them, along with heat and alcohol and exercise. And I'll talk a little bit more about exercise because it's very, very different than typical chronic fatigue. And interestingly enough, this 37-page clinical guideline included everything, the occupational therapists, physical therapists, all types of therapy. But what it didn't include was really integrative professionals like ourselves. It doesn't include acupuncturists or yoga or Tai Chi. I even checked to see if there were any supplements that were recommended for something in the functional medicine world, and there was nothing. One of the big things that I found works, and it's super simple, is salt. And again, that's something that is in the clinical guidelines. So what they recommend is just putting salt in water and drinking it, and they recommend a reasonable amount of salt too, usually 2 to 3 liters of water per day, and 10 to 12 grams of salt in that water. So if you think about when you're hypovolemic, when your blood volume drops, then your heart tries to compensate and starts to beat faster. And so that's part of the reason why the POTS folks really feel dizzy. And then also the dysautonomia aspect of it is that when you stand up, your autonomic nervous system immediately squeezes the blood vessels to modulate that, and that kind of goes away, and that's why they'll pass out. They also recommend some compression stockings and things like alpha lipoic acid, coenzyme Q10. B vitamins can really improve mitochondrial and autonomic functions. So I'm a big fan of those supplements. That there was one study done where they took 1 liter or more of IV and they did it for patients for 6 weeks, once a week. And what they found is that after 6 weeks, their symptoms improved considerably. But it's just one study and it's not very high power. So I wouldn't suggest you rush out and recommend the IV therapy to your patients. So now we'll go on to mast cell activation syndrome. As you can see in the diagram here, that you have mast cells produce a number of things, but histamine is one of them, and there's different types because you've heard of H1 and H2 blockers. And so a good litmus test for your patients is just try Benadryl and see if their symptoms improve. And they will dramatically within just a 24-hour period. And so that's something that you should try as just pulling out of your back pocket. And if there's no change to that, then you may want to try a H2 blocker, which will deal with the allergy symptoms, itching, rhinitis. I'm sorry, that's a H1. The H2 is the typical like Pepcid that affects your gut, but it also affects their symptoms as well. And so if you look at the diagram here, you can see that almost every system is affected by the mast cells. You've got the central nervous system, and people will be having headaches and vertigo and nausea. And so you go to the doctor and you say that you've got a little bit of cognitive dysfunction and some headaches you didn't have before. They kind of shrug their shoulders. There's cardiovascular effects. You can see there's skin issues, respiratory issues, menstrual problems. It really does hit every aspect of our health. The H3 antihistamines are for brain histamine regulation, and they're used experimentally for narcolepsy, et cetera. So that's not something you can really get your paws on. And then H4 is more for immune system modulation, asthma, dermatitis, and that's also kind of in the research stage. So that's not something that you can just run out and get your hands on easily. Biofilms is something that, again, until a couple of years ago when I was working with a patient who had Alzheimer's, and I realized that there's a big connection between biofilms and Alzheimer's, that I started looking into it more deeply. And so this schematic demonstrates how biofilms develop from just the attachment to a surface in your body to the formation of this monolayer. And then all of a sudden you get a microcolony formation. And then in later stages, it's mature and it forms something like a mushroom. And then it'll disperse and start back again. And so the reason why sometimes you'll give a patient some antibiotics and they get a short-term improvement, but then they seem to backslide, is because the biofilms are literally protecting these microorganisms from attack because they want to survive. So it's a pretty brilliant approach from their standpoint. But luckily, there are things that are naturally occurring that are biofilm disruptors, one of which is monolaurin, which comes from coconut. And so I've used that in the past. N.A.c. and acetylcysteine is really great to, once again, if you have some infection that's in your lungs, that it can peel that off of your lungs, break it up, and allow you to breathe better. It also, N.A.c. also thins the mucus, which is helpful if you're coughing up a lot of thick phlegm. Serrapeptase is another one, which is an enzyme that is great for reducing clotting. It's a proteolytic enzyme, and it reduces clotting, but it also breaks biofilms. So you've got a double duty in that, which is pretty cool. Biocidin is an herbal blend that I had not heard of until I started doing the snooping. It's got bilberry and golden seal and grape seed, and it's got some broad antimicrobial effects as well as disrupting the biofilms. So once again, very, very helpful. Lactoferrin is something that binds iron. It prevents the bacterial adhesion and destabilizes this formation. So there's different angles at which these research scientists are trying to attack it. And I won't go into detail about it from a molecular level because it's boring and most time people won't remember it anyway. So the thing is that you want to take these disruptors about 30 minutes before you offer some kind of antibacterial, antiviral, antifungal medication. So you kind of knock it down and then you put that in, and you alternate every 2 weeks. So that keeps any kind of adaptation from occurring. So let's talk about treatment approaches. The paper on your right is more of a functional medicine approach, and Minnick and Hanaway did a tremendous job of covering this. Now, this is primarily for COVID-19 versus long COVID, but a lot of what they're saying makes complete sense. And so thing about focusing on food and nutrition and balancing inflammatory pathways. If the plant-based diets, you're probably aware that influenza hospitalizations, for instance, are drop by 12% by increasing fruit and vegetable intake by 5%. That seems like a reasonable return on investment. So I think that's something that it's easy and you can recommend to your patient. It definitely demonstrates that the kale is kind of like a hazmat suit for viruses. So it's definitely got a lot of protective measures there. Vitamin A and D also improve viral respiratory infections. Zinc is known to inhibit the synthesis, replication, and transcription of coronaviruses. I've also heard that zinc will also break cell walls of invading pathogens. The exercise thing I'd like to point out, because again, exercise can be a problem with long COVID. It's great for COVID when you're in it, but long COVID, the studies have shown that when some long COVID patients exercise, it damages the muscle cells, and they'll experience an energy crash. So they can just work out for 20 minutes and feel like they're down for the count for a day or more. And that's because the mitochondria are producing less ATP, the adenosine triphosphate that gives energy to the cells. And so the muscles fatigue rapidly. And then there's actually muscle breakdown. So there's a myopathy and an abnormal protein buildup, which are amyloid proteins or deposits that tend to worsen symptoms. There's an immune overreaction that occurs as well, where more inflammatory cells invade this damaged muscle, and that creates this really vicious cycle. And so the post-exertional malaise trap is really where usually the symptoms will explode anywhere from 12 to 48 hours post-exertion with extreme fatigue, brain fog, palpitations, shortness of breath. And a lot of trainers will say, just push through it. But in this case, that's not the right idea, that you actually really have to instead take little baby steps and just work. And something that the Dalai Lama once said, which is, you should practice compassion every day towards yourself. And I really like that, because there are people that beat on themselves, and especially when they're sick, they feel like, well, they've just got to man up or suck it up and push harder. But in this case, giving yourself healing space, of course, holistic nurses would embrace that, is just give yourself a healing space. So there are nootropics out there that are quite impressive. And lion's mane, rhodiola, schisandra, ashwagandha, nicotine, all of these are really great. Who heard that nicotine is a nootropic? But what's interesting about nicotine, and the patches are better than the gum, because the gum, when you chew it, you do get a certain number of milligrams, but the blood concentration level kind of picks up and then drops off, and you want something that's really slow acting. So the nicotine patches are the way to go. And starting out with 7.5 milligrams, and actually start off with half of 7.5. So start off with about 3 3/4. Do that for a while, and then continue marching up. So there would be a week at the half of the patch of 7.5, then you can go to 7.5. And depending on the protocol, some go up as high as 14, others peak out at 7.5 milligrams. So what does nicotine do? It literally has an affinity for ACE receptors in our bodies, and it elbows out the spike protein. So something that's very impressive, and I wrote an article on that. Both lion's mane and rhodiola are found in traditional Chinese medicine and are supportive of adrenal function, and are helpful for sleep quality. For those who've heard of ashwagandha, ashwagandha is found in the Indian Ayurvedic tradition, and it tends to help with athletic performance as well as sleep quality. So there's a number of things that can be helpful there. And again, in this paper, it lists a whole bunch of functional medicine and nutrition approaches. And I feel that having a multivitamin like Centrum or one a day, you should just throw that away. A lot of nurses call it bedpan bullets because they're just not bioavailable. But having a very high quality GMP, good manufacturing practices multivitamin is a great way to just kind of cover the bases. Melatonin is actually brain protective, which was news to me. I didn't know that. I thought of melatonin, again, when it's a hormone, it does a bunch of different things, but I was thinking of melatonin purely for sleep and sleep quality. But apparently it helps with lymphatic clearance. So people have heard of lymphatic system, and then there's glymphatic system, which is found in your brain. And that when we sleep, there's actually a pumping that goes on to flush out any of the toxins that have collected in our brains and need to, so like a brainwashing that occurs. And so the melatonin improves the lymphatic clearance. It reduces neuroinflammation. It might help with the memory loss and concentration problems. And of course, sleep and fatigue, but also pain, which again was kind of news to me. L.A.c, we spoke a little bit about that. It's a precursor for glutathione, which is, of course, a very powerful antioxidant that our livers produce, but it also is a detoxifier as well for our bodies. Using targeted probiotics is huge because there's studies demonstrating that our microbiome is negatively affected by the spike protein. So if you were to get a GI map or a comprehensive stool analysis, that would be one way to just target where their problem is and then try to increase that group of strains. Akkermansia is a specific strain of a probiotic that people are jumping up and down about. And I don't know if it's initial excitement or whether there's really a lot to be said. So you guys can do your own homework on that. This is something that's relatively new, so I don't know too much about it. The L-arginine is really great, or arginine. It is a vasodilator, and so it helps with lean muscle mass for people who are working out on a regular basis. But it also increases nitric oxide in our bodies. For my male patients who who don't like taking supplements. I tell them that, look, this will put lead in your pencil. So I try to motivate them that way. And so it is helpful for sexual performance. L-arginine also can be paired with vitamin C for synergy. There was a study demonstrating improved endothelial function, muscle strength, walking distance, fatigue for long COVID patients. So there's some really good stuff there. The citrulline on the list is something that tends to convert to L-arginine, but there's no real randomized controlled trials for using this monotherapy. But what the literature says is that it tends to have a less GI disturbance than L-arginine, so something to consider. Fiber is something that obviously is kind of ignored, and in our modern diets, we don't have enough fiber, and that can really be problematic. Something interesting is that before they were saying here, it says consume plenty of fruits and vegetables, including fermented vegetables, and I'm a big fan of that, but fermented vegetables contain histamine, and so people who have issues with mast cell activation, the last thing you want to do is recommend fermented vegetables because they're just going to explode. So some of the things that are not on this list, but I think are really helpful, is D-ribose. And there was a physician who wrote a paper on D-ribose and fibromyalgia and chronic fatigue, and found that 66% of the patients had an improvement, and that was at 5 grams 3 times a day. And you can get it in the powdered form, and it's not super expensive. PQQ is also something that's a huge antioxidant that I started recently taking, but I can't tell you. I'll just say that on paper, it looks very impressive. I wish I could tell you more about it than that. Bromelain and quercetin are amazing for respiratory problems, and I wrote a paper on integrative approaches to allergic rhinitis, and I really promoted those two, and so that's great. And again, there's methylene blue, which is controversial, but a colleague of mine who's a functional nutritionist has been using it for some time, and he thinks that there's some great benefit to that. So if you take glycine plus NAC, the scientists call that GlyNAC, and that's something that improves glutathione and mitochondrial health, and it just does a lot of good things in the body, including reducing systemic inflammation. And as we all know, inflammation is really one of the major contributors to chronic disease. And so what's not to like about that? Well, onto acupuncture. Of course, that's my favorite. And for those who are unaware of the mechanism of action, acupuncture helps with modulating the autonomic function, vagal stimulation. There are acupoints in the ear that are amazing to affect the vagus nerve. So it improves all of the symptoms from anosmia and problems with taste, brain fog, fatigue, depression, headaches, insomnia. There was a study on acupuncture needling stomach 36 on the leg. They found that it increased blood flow in humans when they were doing this ultrasound color Doppler imaging. They found that acupoints on the foot, like liver 3, reduce vascular resistance and increase blood flow. And so that's obviously good for people who are having some vascular problems, or if they have cold hands and feet, indications of poor peripheral blood flow. It's something to consider. I have a lot of colleagues that are chiropractors, big fan. When I looked up the research, there's very, very limited research in both chiropractic and osteopathic manipulations specific to long COVID. Digging, this is one that I found, which is the chiropractic adjustments have axial stability method, which has to do with the axis. So we're talking about cervical stability. And then they have SI joint wedges, which are they're wood wedges that have padding around them. And with a patient prone, they push them under the hips to try to readjust it. I don't know if they do it supine as well, but what I've seen with my colleagues is face down. And then there's muscle balancing, which apparently helps with reducing chest tightness and breathing. As far as osteopathic manipulation goes, there's a number of techniques that improve pulmonary lymphatic drainage, increase total lung capacity. So this is something that's great. You can see the following symptoms that it improves. And I found it on YouTube, so I couldn't find any papers specifically on this topic, but they said that if you have some instability in your neck, that it can trigger POTS, and that if you get that released, then your autonomic nervous system works properly. There was a randomized controlled trial in 2025 of osteopathic manipulation and showed improvement in dysautonomia. So that's primarily looking at fatigue, but at least that's out there. Some physicians cringe when they hear about homeopathy, which we're about to talk about. But physical therapy, interestingly enough, there's interventions of inspiratory muscle training. And this is a terrible picture because what it really looks like, there's something that looks like a kazoo that you breathe, and it resists the flow, and you have different adjustments for how difficult it is to inhale, and that over time helps build the muscle so that you can breathe more effectively. So that's that. Now we'll talk about homeopathy. There was a study out there that demonstrated that 15 COVID patients, various complaints, they got a 90% symptom reduction in 5 weeks, which is really impressive. These 15 did not have the same approach, and that's the way homeopathy is that it's just not one size fits all. They do some weird differentiate. When I say differential diagnosis in homeopathy, it may mean that you have an enhanced startle response, or maybe your hands and feet get cold, or maybe you really like salty foods. So that it's unique in it, and I don't understand it well enough, but just know that the people who are skilled in it do amazing results. And then you have physicians that do a weekend course and they try it and they say it doesn't work, but I beg to differ. And let's see, there was a 2024 study on fatigue and anxiety, and they found that both fatigue and anxiety were improved. In 2020 and 2021, there are 2 years of clinical observation study of 22 long COVID patients that also demonstrated improvement for that time. Neurofeedback is awesome. For those of you who are as old as I am, you know about biofeedback in the 60s and 70s, and that's where they used a tone, and they would actually use the tension in your forearms to identify how tense you were. And then through breathing, that tone would drop down, and you could teach yourself how to relax. Well, neurofeedback is much cooler than that, where you plug yourself into a computer and you are playing a video game, but not with controls, with your mind. So they're trying to influence you to, let's say, get into a theta meditation or a theta level. And when you do, things change on the screen. So they've noticed improvement in both anxiety and depression in these patients. There was a case report on brain fog, and a 34-year-old female was administered. She did 15 sessions, and she had improved memory, reduced anxiety, less pain, and the depression also was reduced, but not clinically significant. And again, for you who were growing up in the 60s and 70s, cannabinoids are something you're probably aware of. And they're known for inflammation reduction, and they reduce the cytokine storm. Um, the thing about cannabinoids you have to be aware of is going to your local vape shop may not be a good idea, because you really need to have very high quality. There are things called terpenes, et cetera, that are measured in these products. And there's GMP, the good manufacturing practices. So you want to make sure that you have something that's more specially formulated to do that. So the study that I've got here, showing that it neutralizes and prevents entry. Again, that's something that's a higher level than something that you would get at a corner store. Fasting, of course, is good for everything. People have probably heard of autophagy, which is the production of stem cells in our bodies. And again, there was a study where they had 14 long COVID patients who fasted for about 6 to 16 days. You see there's quite a bit of improvement in all of these categories, from muscle and joint pain, brain fog. And the beauty of it is it's inexpensive. If anything, you're saving money. So that's something that you could consider, but definitely should be supervised by a healthcare professional, just because you don't want to get hypoglycemic and face plant. Light therapy just really intrigues me. In Chinese medicine and Qigong, they talk about biophotonics, which is the light emanating from the body, but our bodies also accept light as well. And they've shown that light just I wrote a paper that's called Shining Light on Heliotherapy. And it's about how sun exposure is not just about vitamin D levels, but also it increases nitric oxide in our bodies. It reduces blood pressure. If you look at the visible light spectrum and you get out to 670 nanometers, that region, there's different depths of penetration to our skin based on the frequency of light. And this indicates that how you can see that when you get a little bit lower in the light spectrum, that it's barely a tenth of a millimeter. And by the time you get out to 750 nanometers, it gets down to about 5 millimeters in our bodies, which can help with a number of things. There was a study on the average ultraviolet light exposure. And so if you're looking here, you'll see that in the northern regions, it just, you don't get as much light. It's really cold during that time. And then you have the warmer regions, and they're demonstrating just how much light each population is getting. And then based on that, they found that that there was a huge improvement in the number of COVID deaths based purely on exposure to light. And I've got the stuff here. It says the mortality rate ratio in the US falls by 29% per 100 kilojoule per square meter increase in mean daily UVA exposure. Independent studies in Italy and England also found a pooled decline of 32% per 100 kilojoules per square meter. So definitely just being outside is so tremendously important for us. And then this is some of the data there for the data nerds, that you can see how the COVID deaths start to be reduced based on the different frequencies. And this also is great. And it talks a little bit about just that, about the cardiometabolic traits and how they measured lipid markers on certain days, accounted for 7 days of sunshine versus lack, all that. And see if I've got some of the results on the next page. Okay. Um, this, sorry to change direction quickly, but this is amazing. What they did was they looked at near infrared light, and they found that there was a great improvement in shortness of breath, in the mental fogginess, all of these things, and things associated with the dysautonomia, um, purely with infrared light. So there's definitely value in it's neuroprotective, is what I'm saying. And there's another study where they looked at both transcranial, so that means having a goofy looking cap on, or the whole body photobiomodulation in brain fog. And so as an American, you kind of think that more is better, but in this particular circumstance, just the cap work just as well as the whole body. And of course, the whole body unit is probably tens of thousands of dollars as opposed to the small cap. So anyway, that was something that the scientists were kind of surprised at the outcome. And detoxification is very, very important in functional medicine, and different products are draw different. So you've got to target the toxin with the product. So, for instance, there are binders, and the binders will bind or absorb certain chemicals. So a good example is charcoal is considered a universal binder. As you know, if someone gets poisoned, you may give them charcoal pills. It grabs on pesticides, mycotoxins, and drugs. But for heavy metals, it really doesn't do a whole lot. Spirulina, for instance, does target heavy metals, arsenic, cadmium, lead, mercury, all the things that our bodies kind of bioaccumulate. And so that's really, really great. And I tend to use a mixture of spirulina and chlorella once a year just to try to clear out my body. Broken salt chlorella removes the persistent organic pollutants, POPs, dioxins, and PCBs. And so that's what that's for. The bentonite clay is something that you would use if you're exposed to heavy metals or aflatoxins, and aflatoxins come from very specific mold types. So I know there's a lot of information. I do apologize for hitting you with a hose, but I just want to make sure that you guys have an understanding of the broad spectrum of things that you can use in your practice. Again, mindfulness, yoga, meditation. I helped write a book with a colleague of mine called The Scientific Basis of Integrative Health about a decade ago. And what I found about meditation is that it actually affects the gray matter in our brains. So it makes structural changes to the brain, not just changing theta or anything like that, but actually physical changes, which is pretty impressive. So all three, both mindfulness, yoga, and meditation, improve the immune response, help with both psychological and physiological function. So I do yoga now, and I'm 60, and I just feel like things could be a little more loose for me. So I've been doing that for several months, and I just find that it's amazing, the mind-body aspect, because I just thought, yeah, I'm just stretching. But the rest of the day, there's really, I really felt it in a way that makes me not want to stop. I've been practicing Tai Chi and Qigong for about 30, 35 years now. And so that's my baby. When people ask me, oh, should I do Tai Chi or yoga? My answer is yes. So it's not any specific one. What they found with Tai Chi and Qigong that makes it unique is that it helps with pulmonary function and gas exchange. blood oxygen saturation. It reduces the resting heart rate, which is great, but it also increases superoxide dismutase. And SOD is the anti-aging enzyme. So as we age, it declines. And when you do Tai Chi or Qigong, it goes up. And so you've also heard of the ends of our DNA, and it actually lengthens those telomeres, which is also pretty impressive. If you've seen people who have done Qigong for their whole lives and they say they're 85 and they know you look like you're 65, it's really quite, I mean, the proof is in the pudding. So hyperthermia, sauna is something that is looked at, and it actually has been shown to reduce IL-6 and TNF alpha. It improves parasympathetic tone and, of course, vasodilation because you're out there. It helps with muscle relaxation. And it also, you can sweat out specific toxins like lead, for instance. So if you do a hair mineral analysis or something like that, and you can definitely use that. There was a case series that I read about where there were 46 patients. They averaged about 50 years old. And they did 1 to 3 sessions per week of being in the sauna for about 4 to 12 weeks. And at 4 weeks after the last sauna visit, there was less fatigue, less dyspnea. The COVID-associated symptoms, about 63% of the respondents felt like it was effective. So again, this doesn't have a control group. It's not really a very well done study, but it's more of a retrospective analysis, but it still demonstrates some value. So something to consider as well. And hydration and electrolytes are something I briefly mentioned before for POTS patients. And what I recommend is something called Soleil, S-O-L-E. And what Soleil is you take a glass jar and you fill it with filtered water. And then you take a big chunk of Himalayan salt and you drop it in there and you let it just sit overnight. And so it basically dissolves and saturates the solution. And then you take 1 teaspoon of that out and you put it in a glass of water in the morning. And that's something that is easy to do and just kind of helps maintain that blood volume. And I had mentioned before on the left, you can see this is what your ear looks like to an acupuncturist. There are 109 acupuncture points in the ear. There's a neurologist out in France who is named Dr. Nogier. And back, I think in the 50s or 60s, he really got into acupuncture and wanted to know about this map. So what he did was he used a galvanic resistance measure of the skin. And when people came in and they said, my shoulder hurts, he would move around where the shoulder is on the scapha, this area here, and there would be a drop of impedance. And then he would do that for everyone that has a stomach problem, someone that's got sciatica, and he marched around. And so he rebuilt the Chinese map, and it's almost identical when you overlay it, but he had a few differences in opinion from the Chinese. So when I do those points, I will do both the Chinese point and the Nogier point. But as far as vagus nerve stimulation, you can splash cold water on your face, and that can reset your vagus nerve. In Qigong, for those of you who practice, you notice that there's a lot of stroking on the ear, and this ear stroking also shifts you into a parasympathetic mode. Humming is something that if you just like a particular song and you hum it, that doing that every day has some therapeutic value. Gargling is also something that's helpful, but I feel like it's kind of a bother to gargle, in my opinion. It's something that, but if it's something in the morning you get in the habit of doing, it can't hurt and might help. And finally, there's olfactory training. And olfactory training, they have something that's pretty funny. They're called sniffin' sticks. And sniffin' sticks are these sticks that are dipped in one of 4 essential oils: clove, rose, lemon, and eucalyptus. and you sniff them twice a day. And what the studies demonstrate is that if you do that for 3 months, there's something called a TDI score. TDI stands for threshold, discrimination, and identification. So the threshold is, can you just tell that there's something on the stick? The discrimination is, can you tell that it's something that's not rose or not lemon? And then identification, of course. And so there's a scoring, and a meta-analysis showed that there's 25 to 35% improvement from all etiologies, so that the olfactory training is not just for post-COVID patients, but for idiopathic anosmia or post-traumatic anosmia as well. And it's it works with. I always thought that the brain has plasticity, but apparently there's plasticity in how you receive signals for smell as well. And at the end, I just wanted to talk a little bit about safety signals, because this is something that's not shared that much out, and it's important that we talk about this out loud. And one is, if you look at how the new cancer cases, if you look at 2020, that's when COVID hit, and you can see that there's been quite an acceleration since then, and a projection of what 2026 is going to look like. And some blame it on the mRNA vaccinations, and some say that it's just based on the exposure to the spike protein. But as you can see, there's a 17% increase, which is huge, and it should be studied, and yet it tends not to be. And if you look across the board here, what it's demonstrating is, and this is specific to taking the mRNA vaccination, and you can see that uterine cancers, skin cancer, prostate, leukemia, ovarian cancers all rose pretty significantly in mortality rates in the past few years. And that's what the conclusions of this paper were, is that there's statistically significant increases in all of these cancers. And that's in 2/3 of the Japanese population. This is a population-wide study that's peer-reviewed. In my paper, I have a summary table, so that for people who are super busy and they have patients that just are suffering from brain fog, then I have the list of things that are evidence-based: acupuncture, adaptogens, D-ribose, nicotinamide, so that NMN. And you can see I had it for each one. So I just thought that this is helpful. Oops. So this is helpful for just a quick summary. People who are busy, if they are trained in acupuncture, then there are some acupuncture protocol with points here as well. So with that being said, I'll stop sharing, and here we go. And I can open it up for some questions. I know it's quite a lot of information, and I appreciate you guys battling it out, and I'm open to any easy questions you may have.
I was surprised about their sniffing sticks, like people that have lost their sense of smell. They would use those sticks to train their mind again to pick up the fragrance of it.
Yes, it's just because it's a standardized protocol. Instead of putting it on a napkin or something, you can't really control it. So the sniffing sticks actually are something where you dip it a specific distance in the oil, and of course the patient doesn't know which one it is. But I didn't know that there's such a thing as neuroplasticity for your schnoz.
Yeah, yeah.
Well, it's so sensitive, when we talk about our hearing and our smell. what one of the last things that go when we're dying are the hearing and smell too. So, um, and what the amygdala does for our smelling, of course, the memories that it brings up. So,
Yeah, it's very connected, kind of interesting.
Hey, Bill, I had a question earlier because I wanted to get this to start taking myself. You mentioned early on in your presentation, and by the way, it was phenomenal. Thank you. So informative. There's a vitamin. I don't remember the name of it. That's why you said you take 5 grams 3 times a day in the powder form. It said it comes in for fibromyalgia. What was the name of
Yes.
that vitamin again? Do you remember that? It was early on in
Oh,
your
sure.
slides.
Sure.
Diribos.
It's D-ribose, just
Oh,
like the sugar, R-I-B-O-S-E. And D-ribose also won't raise your blood sugar. So for people who are diabetic, it's not dangerous for them. And
Okay.
you can just put a couple really thick lines on a mirror. And no, I'm just kidding. You can't do it that way.
So
Mix
D
it with water.
So
And
D-Rib comes in a pipe. You can buy it at the drugstore over the counter, and you.
yes, you can,
Oh,
and you can also buy it in capsule form. But 5 grams is quite a bit of powder, and so it's just a hassle to take
okay.
uh, via capsule. So that's the reason why I recommend the powder. And it doesn't
Okay.
taste nasty either. Just mix it with water and drink it.
Okay. You're
Mhm.
very informative. Yeah.
so
Oh,
does Walmart and Amazon sell these too?
Amazon would probably sell D-ribose. I'm not too sure about the. Well, I don't know. I don't really check the websites that much, but
Yeah.
I tell you that it's important to make sure it says GMP, the good manufacturing
Yeah.
practices on it, just to be safe, because they do gas chromatography and mass spectrometry on their products so that you know
Yeah.
that they're good.
In any good aromatherapy course, we use sniffing sticks too.
Oh, no
Oh,
kidding. Oh, that's
okay.
great.
We're good at that.
Seriously.
Interesting.
Yep.
Interesting. You we need to hear more and learn more about this. And the aspect that I really liked the most, and it resonated with me when you were talking, I thought about the as you being an engineer, the electrical engineer Nikola Tesla, and how your career has evolved, and now you're into this work as an engineer. And I was looking at one of his quotes, and he says, "The day science began to study non-physical phenomena, it will make more progress in one decade than in all the previous centuries of its existence." And when I listen to this, and even all the data, even though it's come from clinical guidelines and evidence-based practice, what we do need to hear more of is the evolving work in non-physical phenomena to enhance humanity's healing. So it's coming, and you're on the verge of I think, some new discoveries as you continue to engage in this work. So I'm excited for you.
And you know what's so interesting, Cheryl, and I'm sure that our Dr. Reddy knows this already. Barbara Brennan was also a NASA, and she started the Barbara Brennan School of Medicine or Healing way back
Okay.
when. And so when you think of how she brought the world of knowledge from like he is doing for us right
Uh-huh.
this very moment.
Mm-hmm. Mm-hmm.
I don't
So
know if it's a quote from Tesla or not, but it said that the future of medicine will be light, sound, and vibrational healing.
yeah, that's
And
Tesla. Yeah, that's
and
him.
so
Mm-hmm.
my colleague, who's the functional nutritionist, he has what's called a biocharger, and a biocharger is a $17,000 device that sits about 3 feet tall, and it is a real Tesla coil that has close to 1,000 programs on it that clear everything from a fluke out of your body to mold and anxiety, depression, low back pain. It's a really impressive thing, and you can have 6 people around it at once. So that's one toy. Another one he's got, which is so I have pulsed electromagnetic frequency devices in my office. So I've got a biocharger, which is I'm sorry, not biocharger, biomat, which has
Uh-huh.
tourmaline and crushed amethyst that's heated, and it increases blood flow and ATP in your body. And so that's what I have. But his toys, he's got something called a Metatron, and a Metatron comes from Russia. It's about a $50,000 device, and it it measures a torsional field of your body. Now, I have never heard of torsional field related to biology, so this is news to me. And it looks like a pair of small headphones that you put on your temples, and it it pulses some electromagnetics, and then your body reacts to it. And based on the reaction of your body, what they did is they reversed engineered. Let's say you take 10,000 Parkinson's patients and you put this characteristic pulse and their bodies all react a certain way. Then they put that in the database and then they reverse engineer it. So when he put it on me, it said that my left eye was a little bit farsighted, which is true. Said that there's something with renal calculi, and I do have a history of kidney stones. It said that I've got a little bit of osteoarthritis, which at my age is not surprising, and a couple other things that were all as accurate as I could believe. So that's something that that is impressive. He's also got a light therapy called a Roxiva, if anyone's heard of that. I think it's spelled Roxiva, Roxiva. And it's a flashing light that with your eyes closed and headphones on, it does brain entrainment and can get your brain into, let's say, a theta or an alpha state. And I've tried that and I'm pretty impressed. He said that a gentleman that was an alcoholic got on that machine, and in one treatment, he hasn't had a drink since. So,
you are really on the forefront of what we want for our healthcare system.
Exactly.
Because right now it's sick care system. It's not health
very much so. Very much so.
And you are part of being the healer that we need. And healer is right relationship with ourselves, with each other, and with our very own body, let alone our, who our higher power is. So I'm so grateful. We are Caritas is so grateful that you spend the time, that you share this wisdom with us. And you are, you are really a light bearer.
You're very kind, and I appreciate that.
It's the truth.
Yeah, it's the truth. It really is the truth. I did all of those comments, Patty. And the fact that, most presentations of this nature, no one ever mentions or talk about compassion. And for you to interject that, the Dalai Lama and the importance of self-compassion for our own healing, it starts with self. So that is so important. And so my question to you is, because what we're hearing is a reminder of what we've already known. But what has happened to humanity is we've just gotten so conditioned in all these things that doesn't even matter, that we lose sight of what's important, that has really precipitated and manifest, even COVID and other symptoms that we have. Do you think it still has a lot to do with how humanity is so grounded in capitalism? And see, a lot of what you talk about is definitely holistic, but when human beings empower themselves and understand the innate intrinsic healing power within themselves, it won't require them always going to a doctor or taking medication. So a lot of times I think it's because of fear, and people don't want to lose that control, or thinking every time you go to the doctor, you got to take a pill for this, when you can go take a Tai Chi class, or something like that. And even in Atlanta, where I am, they offer Tai Chi, Qigong, mindfulness training, yoga free. It's all free in community centers and, things like that. But people they don't want to engage in that. Sometimes they prefer seeing a doctor and the doctor tell them that, well, they prescribe medication and everything else.
I think they've lost part of fixing. I want you to fix me instead of intrinsically, like you said. We know, studying Caritas and our whole Gene Watson philosophy, we know inside, just like Dr. Reddy shares with us, what he has brought about in his own knowledge and sharing that wealth of it, that we can heal if we choose to heal instead of buying a pill. Like he started out, Big Pharma is running. It's not whole health. We need a new paradigm.
Mhm.
And I'm so glad that the VA was the forerunner in it.
The VA was, but VA still has a long way to go because I think about, even working with those young veterans, OEF, OIF, in the Afghanistan and Iraqi war back in 2006, and now we're in another war, how they would come and say, well, when I talk about my anxiety, my PTSD, from my lived experience on the battlefield, all the VA doctors were writing prescriptions for antipsychotic medications. They want, even though we had a whole health program, they weren't referring them to the program. They just want to give them medication that kept them zonked out for days and days. So there's a lot we still have to be awakened to. So
And
thank you for the work that you're doing again, Dr. Red.
it's groundbreaking and also from the ground up because you're spreading it that way. And especially now with your podcast, the people that you will reach, I mean, that's how it happens. It's our veterans that wanted the change. They don't want drugs. They don't want
They don't.
narcotics.
They don't.
They want to be in control. So you are such a gift and really bless you. And I'm sorry that Inova let you go, but you are a wealth to us and a blessing.
Yeah.
And we
Well,
intend to share you.
it was really a blessing
I
in
agree with you.
disguise. I really prefer a private practice because I have the freedom to take an hour and a half with my initial evaluation and treatment, which the hospital system's kind of tight, and it's very, profit driven. And
So
it's
you
just the
that's
reality of our system,
yeah.
and like you said about the PTSD, that the VA has 1,200 locations. 91% of them offer acupuncture, so
I
it's
know.
on the rise. There's a lot of resistance, and the people who are doing the acupuncture are medics, and they're trained in a 5-point
Mhm.
protocol for auricular,
All right,
specifically for
BFA, our
PTSD,
BFA
Mhm.
program. Uh-huh.
Mhm.
and
Mhm.
then battlefield acupuncture as well.
Yeah.
So they're slowly starting to. What happened was that they were having a difficult time trying to figure out how to pay us and at what rate they would pay us. GS11, GS10, are we a technician? And by the way, when you said Dr. Reddy, please, it's just Bill because I'm in Virginia. I'm a licensed acupuncturist. If I were in New Mexico, I would be a doctor of Oriental
Yeah.
medicine. If I were in Florida, I'd be an AP and acupuncture physician. But here, I do not have the doctor title, so I don't.
Well, yeah, well, you have evolved wisdom and knowledge, so we consider you a
Exactly.
doctor.
And
So
and and
Fine,
we consider you a doctor.
and
A
like
doctor of philosophy. That's what we're saying.
there
Not
we go.
of medicine.
and also you bring like when we talk about the word Messiah, someone coming with knowledge.
Exactly.
And that's who you are for us.
Yeah. And
And
take away the just. I don't like when I hear people say, I'm just this.
yeah,
You
amen.
are, look,
Yeah.
you are somebody.
Yeah,
Well,
that's
you
And
right.
you're
are
a very
more
good
than
body
enough.
for
That's
us.
right. So, it weren't many on the call because it's Saturday. I know lots of people at their kids, grandkids, soccer practice and matches and all of that. But this information we're going to definitely take out and spread. I'm going to connect with at least 5 people after this call to share, the information with them. So, yeah. That's how we
It'll
continue to spread the word.
Yes.
it'll always expand. I don't mind at all. And my colleague, who's um, the functional nutritionist, he's willing to come on and talk to you about the hidden, which is hormones and immune system, digestion, detoxification, energy, and nervous system. And so he's considered more like a metabolic detective, where he's,
Okay.
Oh, what fun. What a fun title.
Uh-huh.
yes, yeah, and he's really good at what he does. And there's certain measures, lab work that I had no idea even existed. Things like if your cellular membranes are operating properly. I didn't even know there was such a thing. But so he's got access to all these really wacky stuff. My website is billreddy.com, so it's easy to look at mine. His is called Thrivality, which is like thrive and vitality. Thrivality, and his name is
Oh,
Eric Shadd, Shadd.
I think
Good
we
man.
did have him. I know him.
Oh,
Yes.
okay. I thought I
Yes,
connected
it
you
was
guys, but I didn't
over a
know.
year ago, but we did
Okay.
have him on. Yeah, he
Oh,
was
that's
cool.
great.
And I loved his ending. He gave I mean, with all this technology and machinery he was talking about, he gave this just a heart print of a closure. It was like a prayer. And it was like, wow,
Mm,
where did this
mm,
come from
mm,
this guy
mm.
with all these machines and.
Toys. Yeah, that's what I call my stuff, toys.
Good. This was outstanding. Thank you so much.
Yeah.
It's a pleasure. I'm so glad you guys could have me, and I hope you guys have a lovely rest of your day.
Well,
Okay,
I'm going to look
you
at
too.
salt in a different way and get rid of my multivitamins.
Shoot me an email. I know a couple really good ones.
Okay.
Okay,
Okay.
okay.
All right.
And Carol, you pass them on to me, the
Me too.
multivitamin.
Okay.
Okay,
All right.
okay.
Sounds good.
Blessing.
Okay, because I'm
All right.
I'm interested in anything that's going to sustain longevity and keep me looking 20 years younger. So,
Oh,
I like it.
that's easy for you, honey
yeah.
bun.
No doubt.
Okay, bye-bye. Have a great day,
All right.
everyone. Love
Take
you
care.
all.
Sarah,
Bye-bye.
Sarah, can I ask a question before you go? Thank you. I
Who-
won't call you Dr. Reddy, but I am so blessed by your presence in our lives, truly.
Oh, thank you, Patty. It's really, I appreciate that greatly.
Yeah. So.